Cameron here, registered physiotherapist. Today I'd like to talk to you about the importance of recognizing different muscle imbalances and biomechanical issues with regards to injuries that do not have some sort of trauma involved. So I see this a lot with patients where they come in and there's been essentially an insidious onset of pain. So no specific incident, no fall, nothing of that nature that should, in the opinion of the patients, bring on any sort of pain. And they're coming to me in this sort of confused state, whether it's sort of a hip issue, a knee, perhaps something going on with the shoulder or lower back neck area, where all of a sudden one day they wake up and they're starting to get pain in a certain area. No specific incident has happened. There's been no, as I mentioned, no fall, no real reason for the patient to believe that anything should be going on from a pain perspective. And so I can really appreciate and empathize with that confusion with regards to this sudden onset, so to speak, of pain. Now, one of the most important things for an individual, for a patient who all of a sudden experiences pain that's, again, seemingly has come out of nowhere, is to make sure to check on different muscle imbalances. And this is where it's really important to have a thorough sort of investigation in terms of different areas that might be weak and different areas that might be maybe being overused or tight, that can be related to a specific injury. So for example, let's use the example of hip bursitis. So hip bursitis, it's essentially, it's inflammation of a bursa that is on the side, so to speak, of the hip or the femur bone. It's one of the more common sort of injuries that we would see, where in a lot of cases, again, this pain can more or less just come out of the blue. And typically, again, it's a result of different muscle imbalances coming about through either ways that the patient might be walking, holding themselves. They might, quite frankly, they might have had these different muscle imbalances for years, and essentially it's only been recently that it's actually produced an inflammation of some type. So in that particular example, when we're thinking about again, hip bursitis, in a lot of cases with that, the IT band, which is essentially connective tissue that runs straight down from the hip down towards the knee area, will be significantly tight. It will be over time, as a result of this tightness, it actually will rub on the undersurface of the bursa on the side of the femur, and that will create, again, over time, this inflammation. Now, the key aspect to keep in mind with regards to this scenario is that the IT band being tight, it's a result of weakness in another area. So again, this is where it's so important to investigate and have these different muscle imbalances examined. So again, in a lot of cases, tight IT band, if we look at then glute strength, the glute med muscle in particular, which is one of the muscles that's responsible for, it's called hip abduction, bringing the hip out to the side, or keeping the pelvis parallel. If in a lot of cases, again, when the IT band is tight, that muscle will be quite weak. So the tightness in the IT band is actually a compensation that's occurring, that's now leading to bursitis, again on that bursa on the side of the femur, as a result of a weak glute med. So for a lot of patients that I see, they'll describe, this sudden onset of pain. They might even be doing the correct stretches, right? So they might recognize, hey, you know what, this side of my hip is really, really tight. I'm going to stretch this out. But they're not recognizing how there's other muscles that might not actually be firing properly, that are weak, that's causing this compensation in terms of the IT band being overused and tight. And so the way I like to talk about the body is it's more or less like a chain. So certain areas influence and affect other areas, and we have to see where these muscle imbalances are more or less taking place. And we have to recognize what muscles, isolate and recognize what muscles need to be strengthened, what muscles need to perhaps are working overtime and maybe are guarding and need to be released. And also, further to that, we need to recognize what biomechanical factors might be related to how these muscle imbalances originally occurred. How is this person standing? How does this person walk? How do they fire their glute muscles perhaps in a weight bearing versus non-weight bearing situation? So it can become quite complex. And again, it's really something that needs an objective evaluation to make sure that there's a correct exercise program to perform that's specific to how the individual is presenting. If this is something I can help you with, please feel free to email me at erichammertherapy@gmail.com, or you can also call if you have any questions, concerns, or if I can be of any assistance. And again, if you found this video beneficial, please feel free to subscribe below, and have a great day. Take care.